We are so pleased that you could join us for our webinar series around the celebration of the 30th anniversary of the Americans with Disabilities Act. Normally we would be meeting in Salem at the Roberts Building and having our celebration, but this year, of course, we were actually going to meet in a bigger location and have a bigger event, and we were very excited about it. And we're still looking to maybe do that in the fall. So we're holding our breath that maybe we can get together in the fall and still have a celebration where we can see each other and hug on each other. But for now, we are having a 4-week webinar series starting out today, looking at the ADA history, and then next week looking at disability language and etiquette, and the following week on July 21st looking at assistive technology and universal design, and then Tuesday the 28th we will be doing effective communication and the COVID-19 epidemic. And we're very pleased with this series. We hope that everybody will be able to join us at the same time each week. And we're just so glad you're here. We did want to say that the governor has issued a proclamation, and we can, of course, send that out to you, but it talks about the history and the celebration of the 30th and the fact that she has recognized the 30th anniversary of ADA, and each year the governor does issue a proclamation around ADA. Just very briefly, we are joined today certainly by Angela Weaver, who is my vice chair of the Oregon Disability Commission, and also by other commissioners. And there's a lot of us here today. We have 200 participants, so we're not going to be able to do individual introductions, but I'm sure we have a wonderful group, and I'm sure many of our commissioners have joined us. But very quickly, the Oregon Disability Commission is a gubernatorial appointed commission that has been around for decades and represents, has proudly represented our disability community and advises the governor and the Legislative Assembly, DHS, the Oregon Health Authority, and other entities within our local communities. And we are there to support and advise on all kinds of different issues. Most recently, we've issued recommendations around COVID-19 and have been working very closely with Disability Rights Oregon on a number of different issues and the coalition that is formed around that. We are very involved in the legislature, although we are limited by our gubernatorial appointment, but we are able to get around, and particularly to educate around disability issues. We have our Pi Day each year, and we go around to every legislative office and talk about the different services within our disability community. And it's a wonderful event. We give out pie, so people, they want to listen to us because they get a piece of pie. We're also working on other issues. Most recently, we were helping to form what we call the SADI Coalition, Stop Aging and Disability Discrimination in Employment, and we plan to work very hard to develop legislative and other changes around discrimination against elders and people with disabilities in work environments. We work on all kinds of other issues: housing, transportation, access. We do many, many wonderful things, and we welcome you to attend our meetings and to become a part if you ever want to apply to be a part of the commission. So anyway, that gives you a little bit of an introduction. Joseph, before I introduce our speaker, do you want to say anything else about captioning?
So this is Joseph, and yeah, so the captioning link has been added in the chat box. And so anyone that would like to access the caption can click there, and they will be able to view what our CART provider is doing for us with captioning. And also, I will be managing the chat box. So if you have any questions, please feel free to type it in there. And we are trying to hold all the questions at the end of the presentation, but once the presentation is over, I will start reading off some of the questions. And at that time, if you have questions as well, either just enter it in the chat box or give us a thumbs up that you do have a question, and I will call your name out as soon as I get to it.
Thank you, Joseph. Joseph is our wonderful staffer, one of our great staffers for the Oregon Disability Commission, a longtime disability advocate himself. Well, without further ado, we would love to introduce our presenter. I did want to let you know that the Northwest ADA Center is a co-sponsor of this event with ODC, and they have been a tremendous support to us and will be main presenters in a number of our webinars. And we are just very, very grateful to them for all that they have done for us and how they've supported us in this and do so every year. But we are very honored to have Michael Richardson with us today. We'll have him introduce himself in more depth, but he is the director of the Northwest ADA Center and has been a great help and support to us over the years. So Michael, welcome, and thank you for being here to talk about the history of the ADA.
Thank you, everybody. Just do a quick sound check. Am I coming through okay?
Yes, I can hear you.
Okay. Let me thank the Oregon Disabilities Commission and everybody involved for having me be part of this. It's been a fun experience with the planning and regarding, especially with the COVID-19 pandemic and switching gears and trying to figure out how we can go about celebrating the 30th anniversary of the ADA. So I'm glad it's all worked out. What I'll do is, just for the sake of time, go through my presentation and hold the questions until the end, just to make sure we get through this. It's not a very extensive presentation. What I intend to do is sort of do a general overview of the history of what led to the passing of the ADA and sort of a surface touching of some of the key things that have happened in recent history. So we could spend a day talking about this really and talking about the various great individuals in the disability rights movement and the events that have happened over the last 20, 30, 40, 50 years. But today we just cover some of the more commonly known events and people that have played a significant role in how the ADA came to be. So as Jim mentioned, I direct the Northwest ADA Center out of Mount Lake Terrace, Washington, just north of Seattle. I'm a person with hearing loss. I wear a cochlear implant, having grown up with hearing aids and a progressive, getting worse hearing loss as a kid, an adolescent, and an adult. I know ASL. I have a foot in the deaf community, and a previous experience as a voc rehab supervisor, counselor for the state of Washington, coordinating accommodations at the University of Washington for students. So my whole career has been in the field of providing services and awareness and education to people with disabilities and, of course, people without disabilities. And on this first slide, we have two logos of my center with a 1-800 number that is available for all people to call should they have any questions about the ADA. And on the left is the ADA 30th anniversary logo. And I will be doing image description throughout my presentation just for the purposes of accessibility. Next slide, please.
Sorry, for some reason it's not moving forward. Give me just a second.
Sure.
While we wait for just a brief second, I did want to make you all aware of the fact that the webinar will be recorded and available on the ODC's and the Northwest ADA Center's websites with links to the OODH's website. We also wanted to tell you at the three dots at the right, at the top corner, is a drop menu where you can change your name, and that you should please keep your audio and video off during the presentation. And also questions you should put into the chat box and the evaluation poll at the end of the webinar. We very much appreciate if you'd fill that out. So anyway, I'm sorry for barging in like that, but I was supposed to say this stuff earlier.
So thank you. And just briefly, I will make this presentation available to anybody who wants it at the end. And we'll figure that out either through Joe, myself, or what have you. Just quickly, the Northwest ADA Center is one of 10 regional centers across the country that provide technical assistance, training, materials dissemination, research, and public awareness, all about the ADA. So,
excuse me, I'm so sorry to interrupt. It is time for the interpreters to switch.
Sure.
Sorry about that.
No worries. And so we cover, of course, Oregon, Washington, Idaho, and Alaska. So we are your go-to center for everybody who's on this call, ideally, obviously from Oregon, excuse me, biases there. So we are funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, which is under ACL and Health and Human Services, which ironically is part of the ADA's requirement to provide technical assistance, education, and awareness. And so that's what we're doing today. I do want to acknowledge that we have an Oregon affiliate working out of Community Vision in Portland, Oregon. Her name is Sabine Rear, and she is your go-to person for everything Oregon, as well as our home office staff. So feel free to reach out to me for contact information for Sabine. Next slide, please. Were you able to switch to the next slide?
Sorry, I'm trying to switch interpreters at the same time. Just a second.
Fine. Okay, great. So this slide, disability impacts all of us. And this is from a 2018 sort of a research from the Centers for Disease Control and Prevention, CDC. And what it says generally is that 61 million adults in the United States live with a disability. Now, 1 in 4 of those adults have some type of disability in the US, and 2 in 5 US adults aged 65 or older have a disability of one kind or another. Now, this is important to note because one thing we are doing these days with the ADA National Network is ensuring that our aging population, especially those individuals 65 and older, the aging baby boomers are, who are aging into disability, are also recognizing that they have rights under the ADA as well. Unfortunately, many people do not know they have rights under the ADA. That's one area we want to be cautious of and be aware of, that when we work with people with disabilities, we talk about also those aging into disability. Next slide, please. So this slide, percent of disability groups among US adults. We look at 13.7% have a mobility disability, 10.8% have some sort of cognition or cognitive processing disability, 6.8% have a disability impacting independent living, or usually the ability to go out and do errands, for example. 5.9% have a hearing-related disability, 4.6% have vision disabilities, and 3.7% have a disability affecting self-care, meaning difficulty in dressing or bathing, things like that. Next slide, please. So if we look prior to all the legislation that has been passed to protect people with disabilities, if we look back in the past at what major barriers were faced by people with disabilities and unfortunately are still faced today, we look at unfounded stereotypes and negative attitudes. And if we look back into history, we see sort of this historical perception of people with disabilities being sort of a charity group, for example. You may have recalled March of Dimes fundraising opportunities to look for cures and what have you, which sort of ties into this, what we call the medical model of disability versus the social model of disability. The medical model being that people with disabilities have an illness or disease, and the priority is to try to fix that so they are able to be assimilated into society. But that shift has moved to what we call a societal model, a social model of disability, in which we recognize that the barriers that we as people with disabilities face are not because of us, it's because the environment is either inaccessible or we have attitudes and stereotypes that prevent us from making those gains in society as well. So again, the social model of disability has to do with barriers are there because of attitudes and physical barriers and what have you, and communication barriers. There's also a lack of awareness on the adverse impact of inflexible and discriminatory policies and procedures. A simple example is, years ago, I experienced applying for a membership to a local library, and their policy was you had to have a valid driver's license. So my response was, what if I don't drive because of disability? Their response was, well, that's the policy, which of course I stood on my soapbox and made them change that policy as not to discriminate for people who couldn't drive, because now the policy is a valid Washington state ID. So get rid of the driver's requirement. Inaccessible buildings and facilities were problematic before many of the laws were passed. And of course, ineffective communication processes and technologies, meaning people like myself with hearing, vision, or cognitive processing, which communication is impacted. There were no auxiliary aids and services available to allow us to participate. Next slide, please. So to kind of step back in time and prior to the ADA being passed, we look at what we call the Rehabilitation Act of 1973, with various sections in there. And the most familiar one we talk about when we talk about the civil rights of people with disabilities is Section 504. And what Section 504 did was, and what it does is prohibits discrimination against people with disabilities in any federal program or activity, receiving federal funds. So 504 is similar to the ADA in many ways. We often hear about it in school systems, K-12, higher ed, private and public schools. If you ever had a relative or a child involved in special ed, they either had an IEP or they were on a 504 plan. So that's where the 504 comes into place, especially with education. Now, this law was passed in 1973, but as we often encounter in bureaucracies, things didn't happen right away. So people with disabilities started raising their voices and their collective voice and demanding that action happen. So this passed in 1973, but for several years, nothing actually happened. I'll tell you why in a second. Next slide, please. So when the law was passed in 1973 and 504, in order for it to become effective, regulations had to be issued. For example, defining what a person with a disability is in terms of definition, what did otherwise qualified mean, what constituted discrimination and non-discrimination in the context of disability, et cetera, et cetera. So regulations had to be set before the law could be effective. But between 1973 and 1977, no regulations were implemented. And so during this period, the attorneys for the Office of Civil Rights within the Department of Health, Education, and Welfare, which was the department back then with the feds, basically said, we need to publish these regulations in order to get this 504 law moving. At the same time, we're seeing opposition from hospitals, from the business sector, from the public sector, state and county governments, because they're thinking, what does this mean for us? How expensive is it going to be? what kind of changes do we have to make, et cetera, et cetera. And so this delayed further the implementation of 504. And naturally, people with disabilities at this time started, kind of voicing their concern and if not anger. And they filed suit to get this 504 signed and implemented and moving. And so they won that court case in a federal court. The judge sided with the disability activists and said, yes, they must issue these regulations, but this judge did not say when. So what happened was various disability groups, and these images above, we have a black and white image of folks in wheelchairs, using wheelchairs, including a very young Judy Heumann, who's a well-known disability rights activist. She's second from the left. And in the bottom image, we have individuals using wheelchairs and standing and marching and demanding that 504 be passed. And so the sit-in occurred basically for 25 days in April of 1977. A group of about 150 disability rights activists overtook a floor of a federal building in San Francisco and did not budge until their demands were met. And basically they would not leave until the Carter administration agreed to implement the 4-year-old law protecting the rights of people with disabilities. And it was passed finally April 28, 1977, thanks to the sit-in and the sort of the nonviolent nature of protesting by this great disability group in California. Now, the cool thing about this event was that many people came together to support this group while they did the sit-in. We had indigenous groups, LGBTQ groups, even the Black Panthers Party all chipped in to provide food and necessities to help these folks stay there for 25 days. So it was quite a community event to make this thing happen. Next slide. So 504 starts gaining steam after it's passed, but there are some limitations. So because 504 applied to the federal sector or anybody receiving federal grants, people with disabilities start recognizing that, wait a minute, what about the private sector? What about public transportation? What about the restaurants, hotels, performing arts, what have you? Where can we find our rights to access all parts of our society and civic access? And so people with disabilities now, having realized they had a voice in helping pass 504, knew they had the opportunity to make a case for pushing for broader protections and access, which was to become the ADA. Next slide, please. Now, here's another slide, an image of several people, quite a few people using wheelchairs and blocking a public bus in a street. And this took place July 5th and 6th, 1978. This was called the well-known Gang of 19 situation, and of all places took place in Denver, Colorado. And this is commonly seen as one of the beginning of the disability rights movement events as well. And on this day, 42 years ago, 19 individuals blocked the busy intersection of Broadway and Colfax in downtown Denver. And if you've ever been to Denver, those are very busy streets. And you can imagine the headaches, and for a good reason, were caused by blocking public transportation. And so what this group does, the Gang of 19, also known as the ADAPT group, which stood for it's just slipping my head right now. It'll come to me in a minute, trust me, ADAPT, Americans Disabled for Accessible Public Transit, there we go. So not only did they demand accessible public transportation, but they were also demanding that people would be released from institutions that were designed to house people with disabilities. And the reason I bring this up is because this played a big part of the disability rights movement as well, ensuring that people were no longer relegated to institutions, but were able to live in their communities with the appropriate support, which eventually led to the Olmstead decision in 1999, which of course is quite a ways down the timeline, but it was a sort of a symbolic court decision recognizing the persistent and continued and long-standing fight for the deinstitutionalization of people with disabilities. And so basically, in a nutshell, the Olmsted decision was a situation in which two individuals with psychiatric and developmental disabilities voluntarily committed themselves for treatment to a psychiatric hospital. And upon being cleared by medical professionals, unfortunately, they were not able to leave and will continue to be housed there for several more years until they finally filed suit. And so basically, the Olmsted decision was a decision to ensure that people with disabilities had the rights to, if they wanted, to live out in the communities with public supports, personal care assistance, what have you, and be able to be part of the community as we all want to be part of. Next slide, please. So also, I want to recognize the independent living movement plays a critical role in the passage of the ADA and continues to be sort of a critical part of ensuring the rights for people with disabilities are met. We have an image here of Ed Roberts using a wheelchair, and there's a person behind him holding a sign that says Civil Rights for Disabled. Now, the independent living movement basically started in Berkeley, California. In 1960s, a group of students with disabilities at UC California at Berkeley, known as the Rolling Quads, as they call themselves, and led by Ed Roberts, worked on removing barriers on campus. And this not only included architectural barriers, but also barriers to be able to live like as any student did on campus and receive appropriate supports to be a successful student. So Ed Roberts is considered the father of the independent living movement. And as part of this group, this sort of galvanizing group of students on the Berkeley campus kind of moved forward with their education, they realized they needed to have sort of an independent entity that is run by people with disabilities, and decisions are made by people with disabilities regarding sort of the freedoms and the rights and the rights to access for people with disabilities across the country. And so his example continues to inspire and motivate disability advocates everywhere. And today there's roughly over 400 centers for independent living across the country that are usually run by people with disabilities and are there for ensuring that our voices are heard and that our needs are met. And so I encourage anybody in city government and what have you, or even in the private sector, as you work to improve accessibility, is that you also reach out to the Centers for Independent Living to get their voice and their perceptions and their recommendations and their advice in how to create greater access in the work you do. Next slide, please. So some of the things I've talked about, independent living, 504, we think about the 60s and 70s, all these things are happening across our country. We had the Fair Housing Act, which is part of Title VIII of the Civil Rights Act of 1964. We're making their own new rules about non-discrimination on the basis of disability in housing. We had the Architectural Barriers Act of 1968, which was requirements for physical access in some federal buildings. We had the development of the independent living centers. We talked about the ongoing push to move people out of institutions in the 70s, throughout the 80s as well. We had the 1975 Education for All Handicapped Children Act, which is now known as IDEA, Individuals with Disabilities in Education Act. And then, of course, Section 504 of the Rehab Act. So all this stuff sort of boiled down together in what we call a perfect storm of things to happen in order for the ADA to come to fruition. And this image is also obviously a fake image of a large tornado and a house swirling upwards. Perfect storm. Next slide, please. So now it wasn't as simple as telling Congress to say, pass the ADA, it's the right thing to do. You have to convince them, as we have to do with often our politicians. So what advocates and lobbyists did was present Congress with information about people with disabilities, you know, as we build up the passage of the ADA. And for example, showing Congress that people with disabilities on Social Security disability programs and SSI were costing billions of dollars annually. 82% of people with disabilities wanted to work. And at this time, there were no protections to really outside the federal sector to be not discriminated against when applying for work or looking for promotional opportunities in the workplace. And at that time, 43 million people met the Act's definition of a disability. So, and in this process, we had some key players such as Justin Dart, who used a wheelchair himself. He was pretty much the most well-known person in the passage of the ADA. We had Patricia Wright, who was a woman with vision loss, who worked alongside Justin in helping craft and design and write the ADA. And then, of course, we had retired Senator Tom Harkin, who was sort of a chief sponsor of the ADA and helped get it passed. Next slide, please. So as all this stuff was sort of happening on the Hill in Washington, D.C., other events helped sort of bring the light of the disability fight to the public view. And in 1988, the left image, we have several individuals at the Capitol building holding a sign that says "Deaf President Now," and it's titled "The Week the World Heard Gallaudet." This was when students overtook the Gallaudet University campus because at the time they had elected once again a president of the university who was a hearing person. And as we've seen sort of this history of galvanizing movements of people with disabilities, the deaf community, especially the deaf students at Gallaudet, said enough. We want somebody like us. We want a deaf president. And so they pretty much took the whole campus and held it hostage for 3 weeks and demanded that they have a deaf president. And they succeeded eventually. And I, King Jordan, became the first deaf president of Gallaudet University. And I recall when I was in college, this was happening. And this was shown on national news every night, excuse me, as these events unfolded. And then in March of 1990, we had what we call the Capitol Crawl. And this was put on by, again, the ADAPT group in Washington, D.C. And this was a group of people who got out of their chairs demanding public accessible transportation and crawled up the Capitol steps to demonstrate, first of all, that they couldn't get into the Capitol without accessible ramps and pathways, and also demanding that change take place. So an image here of people crawling up the steps. And this was in the newspapers as well. So these two events were just some of the events that came to the public awareness about the fight for people with disabilities. Excuse me. Next slide. So the ADA is finally signed into law July 26, 1990, 30 years ago. The image on the left is our first George Bush president signing the ADA with Justin Dart on the right in the hat. Again, the chief architect of the ADA. Now, I want to show this image of George Bush most recently, prior to his passing away, showing him using his wheelchair and his service dog named Sully. And I think it was some sort of irony to the fact that when George Bush signed the ADA, he probably did not have any idea that he would one day be a benefactor of the very law he passed, because in the end, he was a wheelchair user, was able to get into places that had access, and was able to use his service dog and bring him along to many public venues. So kind of coming full circle, so to say. Next slide. So just to recap again, why do we need all these civil rights movements surrounding disability access, 504, and especially the ADA? Again, it's to counter myths and stereotypes. It's to remove segregation and isolation, and it's to ensure reasonable accommodations and modifications for equal access. Next slide. So just to remind people, the congressional purpose of the ADA is to provide a clear and comprehensive national mandate to end discrimination against individuals with disabilities and to bring those individuals into the economic and social mainstream of American life. Next slide. And this is something I emphasize at all times because my center, we get calls often from architects or people just asking questions about what is the bare minimum I need to do to be in compliance, et cetera, et cetera. And I remind people that the ADA is a civil rights law, just as it is with Section 504 of the Rehab Act of 1973, as well as the Great Civil Rights Act of 1964. So it's not so much what do I do to be in compliance, but how can I go above and beyond and ensure that people with disabilities have the same opportunity, the same rights as we all do to access civic life in our communities. Next slide, please. Just briefly, in 2008, they passed what they call the ADA Amendments Act, and sometimes refer this as ADAAA. So, and what happened was at the time, the original ADA, many court cases were focusing too much on whether a person was disabled enough to warrant protection under the ADA. So an example being, prior to the Amendments Act, as a person myself with a cochlear implant, an employer at the time could have said, well, you speak well, you seem to do well in a small room, quiet environment. Therefore, I don't think you need an ASL interpreter or captioning for this meeting. And in a court of law, they could have ruled in their favor because I was not disabled enough. But the reality is I still needed that, and I was still discriminated against because of being denied the opportunity to have full communication access. So that's what the Amendments Act did, was focus the shift from, are you disabled enough, to did discrimination actually occur? And they, of course, they broadened the definition of disability to include sort of intermittent conditions such as psychiatric conditions, invisible disabilities, diabetes, for example, conditions that may not be episodic, that may be episodic. So people still have rights for protections from discrimination based on a disability that may be asymptomatic at the time. Just briefly explaining that. Next slide, please. So just a quick overview. There's 5 titles of the ADA, and we tend to focus pretty much on the top 3. Title 1 is employment, which basically says employers with 15 or more employees must provide reasonable accommodations and can't discriminate on the basis of disability in employment, from the application all the way to promotional opportunities until termination. Title 2 focuses on state and local governments in transportation. And the key terminology for this is what we call program access or programmatic access. They still have obligations to provide architectural access, but the main point is ensuring that people with disabilities have access to all programs provided by state and local governments, whether it's the mayor's speech, attending court, being in a jury, attending city council meetings, what have you. People in those situations have a right to request auxiliary aids and services for effective communication, such as sign language interpreters, captioning. And Title 3 is a public accommodations, what we call sort of private sector, meaning hotels, restaurants, performing arts centers must focus on what we call barrier removal, ensuring that people have access to the goods and services provided by that entity. Title 4 has to do with telecommunications. Basically, it's just federal funding set aside for the telecommunications relay service for people with hearing loss and being able to use the telephone relay systems, funding for captioning on public service announcements, things like that. Title V is miscellaneous kind of legal stuff. For example, prohibiting retaliation against people who want to file discrimination complaints. And what's important to note with Title V is that the ADA does not invalidate or override any laws that provide greater protections for people with disabilities. So an example is Title I of the ADA says any employer with 15 or more employees can't discriminate. Now, Oregon state law says any employer with 6 or more employees. Now, from the view of the ADA, Oregon state law offers broader protections and therefore is the law that applies. So you can't simply say, well, federal law trumps state law. This isn't the case. So, and also, of course, Title V mentions must provide technical assistance surrounding the ADA and awareness, exactly what the Northwest ADA Center does. Next slide. So just quickly, these are a list of historical resources that I encourage you to look at. And as I mentioned, I will send these links through Joseph or the ODC somehow so people have access to this. One thing I didn't mention up here, but I think it's worth watching as we are, many of us still at home, binging on Netflix, what have you. Check out Netflix, a great, amazing documentary called Crip Camp. Crip Camp. It's all about these kids in the early 70s attending a summer camp with disabilities. It's a documentary, and you got a young G.D. Human in there as a camp counselor, and you see voices of the disability movement coming out, and they show the 504 sit-in and how many of these camp kids became the next leaders in the civil rights movement for people with disabilities. So in closing, we have 5 minutes left. I just want to say, where are we going from here? I think the ADA has made some great contributions to creating access and civil rights for everybody. We still have a big issue with employment. We're still looking at closely to about 70% unemployment rate of people with disabilities. And it's not so much because people with disabilities don't have the skills or the assets. It's because of the attitudes and the stereotypes that employers make about people with disabilities. It's also some of the systemic barriers we see in school systems, sort of limiting the educational opportunities for people with disabilities. So there's still a lot of work to be done in that area. There's still a lot of work to be done in ensuring accessible healthcare, in my opinion. There's no regulations yet right now regarding ensuring that hospitals have accessible exam tables and equipment. There's nothing that says a dental office has to have an adjustable chair. So there's all kinds of stuff that still needs to happen. But in a nutshell, we made great progress and we still have a lot of work to do. It's been over 30 years. There's no excuse for why we can't provide access. So hopefully I sort of covered some of that stuff in a nutshell. It gives you some insight into how this all came about. But I encourage you to read some more about the power of the 504 sit-in, watch some videos, and see how this all came to fruition. It's a sort of a fascinating, if not amazing thing to have seen and to continue to see. Thank you.
Great. Michael, thank you so very much for such an excellent and interesting presentation. We have there's only about 5 minutes left in our regular time, but we'll go over by a few minutes as long as our interpreters are able to stick around so that we can at least maybe get a few questions in. And we also ask that you fill out the evaluation if you can. We really would appreciate your feedback. So Joseph, do you have any questions that people have put into the chat room?